A pressure injury is an injury that can occur to the skin and underlying tissue due to a prolonged amount of pressure. Many of our clients in village caregiving are especially at risk for pressure injuries, so it is important to help them mitigate that risk. You can do so by the following. Ensure the client is not sitting on any items or injured areas. Ensure clothing and shoes fit properly. Turn bedbound clients every 2 hours. Pad bony areas such as the heels. Avoid friction and dragging when repositioning as much as possible. Avoid moisture by ensuring the client is dry. If you notice any changes to the client's skin, immediately report them to your office. Even a small area of redness on the skin can be an early sign of a pressure injury. Perform hand hygiene and apply clean gloves. If applicable, raise the height of the bed and lower the head of the bed to a flat position. Stand on the side of the bed opposite of the way the client will face. If applicable, lower the side rail. Move the client to the side of the bed closest to you in segments. Cross the client's arms over their chest. Place one arm under the client's neck and shoulders, grasping the far shoulder, and the other arm under the client's mid-back. Move the client's upper body towards you by shifting your weight from the front to the back leg. Place one arm under the client's waist and the other under the client's thighs to move the lower body towards you. Repeat for the client's legs and feet with your arms under the client's thighs and calves. Keep the client's arms over their chest and cross the client's near leg over their far leg. Assist the client in turning away from you. If leaving the client side lying, provide comfort and support by placing a pillow under all pressure points and behind the back to provide comfort and to help mitigate the risk of pressure injuries. Keep the heels floated and ensure the client is not laying on any items or either arm. Lower the height of the bed to a safe and comfortable level and raise side rails for safety if applicable. Properly dispose of gloves and perform hand hygiene. Offer hand hygiene to the client. Place a table in front of the client at the appropriate height. Fill a kidney basin 2/3 full of water. Test the temperature of the water with the wrist and have the client do the same. Place the client's fingers into the basin and support their arms. Allow the client to soak for no more than 10 minutes. Remove the kidney basin and dry the hands and between the fingers thoroughly. Use a plastic applicator stick and a soft cuticle or nail brush to clean the nails. Apply non-medicated lotion to the client's hands. Move the table to the side. Remove gloves and perform hand hygiene. For foot and nail care, remove the client's footwear and socks. Place a disposable pad under the client's feet. Fill a wash basin 2/3 full of water. Test the temperature of the water with the wrist and have the client do the same. Place the basin on the mat. Perform hand hygiene and apply clean gloves. Assist the client in placing their feet in a wash basin of water and allow them to soak for no more than 20 minutes. Apply new gloves. Remove one of the client's feet from the basin and use the other hand to wash the client's foot and between the toes. Repeat with other foot. Remove the feet from the basin and dry the feet and in between the toes thoroughly. Apply non-medicated lotion on the tops, soles, and heels of the feet. Do not apply lotion in between the toes. Remove gloves and perform hand hygiene. Assist the client in putting on socks and non-slip footwear. Discard and clean used materials.